When one has a shoulder replacement surgery, there are definitely the normal risks of any surgery. And the normal risks of any surgical procedure, you always worry about nerve damage and you worry about bleeding. But realize the risk of nerve damage or bleeding is incredibly low, especially when you have a well-trained surgeon. At Ohio State, we only have shoulder surgeons that are shoulder fellowship trained, that do shoulder surgery exclusively and all the time. So truly, those risks are very low in a capable shoulder surgeon's hands. The biggest risks of shoulder replacement surgery are a couple. So one, there's always a risk of infection, and truly that risk is higher if you have had a prior surgery. So we always take that into account in how we manage you intraoperatively if you've had a prior surgery, because the risk of infection is a little higher. Shoulders don't have the standard infections you hear of in other joints, such as staphylococcus. That's a very low risk in the shoulder. We have a risk of an infection that lives in your sebaceous glands, in your armpit, on your chest, and it likes to sneak into the shoulder and hide there, and that's called C. acnes. That is truly the risk for infection for shoulder, but we have a lot of things that we do to mitigate that risk because we're well aware of it. The next risk is instability. So if you have a reverse total shoulder, there is a risk that it could pop out of the socket. And that's why we're really careful with your do's and don'ts the first 3 months after surgery. If you have a normal shoulder replacement, there's still a risk that it could pop out of the socket, and we need your front rotator cuff, which we cut to gain access to the shoulder, that has to heal. And so we're protecting that for 3 months after surgery. And then finally, there's always a risk of stiffness. That's why we want you to be diligent with your rehab. We send you to physical therapy. We have a really carefully developed protocol, because any surgery can lead to stiffness of a joint, especially if you're not doing your rehab and you're not working in physical therapy. And then last, there are some patients that unfortunately still could have pain. You could have pain for other reasons that the replacement did not relieve. That is very low risk, but certainly it can still happen. You might not have that 20-year-old shoulder back, but the goal is that you are significantly better than where you started after a shoulder replacement.